infection prevention and control. Please wash your hands.
Hello, my dear learners. I would want us to look at how we assess a patient, how we assess a woman for gynecological conditions. How can we assess? There are 4 common methods of assessment. The first one is we have to take history of the conditions. We take history from a client. The second one is we have to do investigations. When we do investigations, we are assessing the client's gynecological condition. I want to let you know that we also have to do examination. When you examine a client, you are able to diagnose gynecological condition. And lastly, you could take vital observations, temperature pulse, respirations, and blood pressure. On so doing that, you are assessing a gynecological condition among gynecological patients. So let's go into details. We have talked about history taking. Can we list down the histories we take and probably the reasons why we take the histories? We have to take menstrual history. Why menstrual history? The menstrual history is going to help you know whether a woman is pregnant or not. Because if a woman is pregnant, then they are not supposed to visit gynecological clinics. They are supposed to go to obstetrical clinics to see obstetricians. Much as I also need to know that, to let you know that some patients can have gynecological conditions at the same time they are pregnant. So anyway, we have to rule out pregnancy such that this patient is not given drugs they're not supposed to receive and many things. We have MENAC as a menstrual history. You should know when a woman got her MENAC. Probably you also need to find out her last normal menstruation period, because this is going to let you know whether she is pregnant or not. Some people take long to have periods. Some people, when they take long to have periods, that means they are going to have their last normal menstruation periods after some months. So that really helps us to know whether they have gynecological conditions or not. Among the histories we have to take in gynecology, we have to find out the sexual behavior. We take the sexual behavior, let us know the sexual behavior of that woman, such that we rule out infections and we are able to manage them. We have to do family planning history. Why family planning history? Because some people may have menorrhagia, may have menstrual disorders anyway, which we have to manage in gynae. They may even have amenorrhea, which is lack of menstruation periods. So we have to find out why they are not getting menstrual periods. Probably the pathological conditions that they are having with their female reproductive systems are the ones that are affected. So we have to take the family history. Obstetrical history is very important. It's relevant. We have to know whether she has been pregnant, the number of pregnancies she has had, and if they had any complications. Because if there's a complication, it lets us know the cause of the pathological condition, probably. Well, we have to take history of pain. People in gynecology, I would say it is the study of, gynecology is the study of women's conditions related to the reproductive system. So when they are diseased, then they will come with history of pain, probably. If they had cancer, probably they will say here, have pain here and there. So we have to know where the pain is. We have to ask about the characteristic of the pain, whether it is dull, whether it is sharp, whether it is piercing, whether it is a burning pain. Is it a gripping pain? Where is the location of the pain? What worsens it? Is there any relief she got? What is associated with that pain? Is it a menstrual pain? Is it after coitus? Is it due to the bleeding? So anyway, the history of pain has to be found out. We have history of drugs used, so we have to ask a client which kind of drugs they have used that are related to the conditions they are having in gynae. Then we look at the present general states. We ask about physical and sexual abuse, whether they are abused. We have to assess their mental state. We ask questions concerning, okay, questions like, are they feeling sad? Are they happy? Throughout their mental state anyway, and to know their present general health state. Those are some of the histories we take when we are ruling out gynecological conditions among women. We said one of the assessment was history taking, and we have seen some of the histories, but we also said there is examination, so we need to know what we examine, why examination, where do we examine. So we shall prepare for some demonstrations and see what to exactly examine. But as of now, we need to know that in gynae, we have to do breast examination to rule out abnormalities of the breasts, because a woman can have breast cancer, so we have to do breast examination. But as well, we teach them how to do self-breast examination. The other examination is abdominal examination. We have to find out the shape, color, sky, any swelling, any, we palpate for tenderness. We find out whether there is an enlarged spleen, splenomegaly or hepatomegaly. We palpate the abdomen to really find out that. Then we do pelvic examination. We can do pelvic examination to rule out pathological conditions around the pelvis. We can do that by doing speculum examination, by obtaining a high vaginal swab. We can do pelvic examination. Then with the investigations, there are some investigations we do in gynecology, and we say the investigation is a form of assessment. We are assessing a client to rule out gynecological conditions. So we have investigations that we can carry on. For example, a Papa Nicolau smear or a test, a pap smear or a pap test. This one is done to rule out cancer of the cervix. They obtain a cervical discharge or a cervical mucus in the cervix, and it is tested to see whether there are no cervical cells. If they are, then that means the person has cancer of the cervix and the person has to be managed in the Cancer Institute. We have ultrasound. A person can go for sonography to rule out the state of the pelvic, abdominal area and any abnormality. We can do colposcopy. Usually, it is ordered when there has been a normal pap smear test. They want to find out whether there are no signs of the cancer. They can do a colposcopy. Then biopsy, of course, they remove a small tissue to still go and test it and find out whether somebody has cancer cells or not. The other investigations that are carried out can be cervical curettage, which is a procedure done still on the cervix to find out whether the cervix is normal or abnormal. Ionization of the cervix can also be done. Endometrial biopsy can be done. This is an investigation done. There can be seroscopy, where they use probably a scope to be able to see, to view the uterus and its contents, what is in the uterus. People, ladies and gentlemen, they can do a dilatation and curettage as an investigation done to rule out gynecological conditions. They can do hysterosalpingography as a test as well. They can do laparoscopy, and lastly, they can do choledocentesis. Those are some of the investigations that can be carried out. They can still do CBCs, they can do, apart from that, they can do high vaginal swabs to rule out all the diseases that a woman can have as gynecological conditions. We talked about the assessment and we said TPR, BP. So for that one, I may not go into the details because you know how to take temperature and its relevancy. You can take, of course, temperature, external temperature helps us to know if there's any pathological conditions in the body, because if there's no homeostasis, then that means the body is having some abnormalities, maybe sickness or conditions. You know how to take blood pressure and its relevancy, and pulse and respirations. People, any change in the investigation, I mean in the vital observations, can justify pathological conditions. So that can be used for screening patients.